Thank you so much, Andrew, for providing us with the opportunity to present to this wonderful audience. You did such a good job of introducing me and covering what OMPRN is, but let's say for the sake of the recording, I'll I'll just reintroduce myself and talk a little bit about OMPRN. So for those of you who don't know me, my name is Kyster Nanan. I am the project manager and the education lead for the Ontario Molecular Pathology Research Network. I really am happy to be here as part of this SCRI Pen session. So before I pass it over to Leigh-Ann to talk about our micro lesson initiative, I wanted to spend a minute or two just going over what OMPRN does and who we are. So, like Andrew said, OMPRN is a provincial network that is funded by the Ontario Institute for Cancer Research, or OICR. We bring together pathologists, scientists, trainees, and more so over the last couple of years, patients and community members to support research and education in molecular cancer pathology. The overall mission of OMPRN is to strengthen Ontario's capacity to do really interesting cutting-edge cancer research and help bridge the gap between things that we find out in the lab and the real-world impact that we can get in the clinic. Some of the ways that we do this is by supporting translational research, by hosting scientific meetings, and also by developing accessible educational resources for healthcare professionals as well as the public. We are also working to ensure that the voices and experiences of patients and caregivers are blended in or woven into all aspects of OMPRN, from the way that research questions are framed, all the way to how the results are communicated and how they are actually implemented in the clinic. And this brings me to Leigh-Ann. Leigh-Ann is OMPRN's patient partnership lead. She has been indispensable in shaping the way that we approach patient engagement and education. And today she's going to be talking to us about a micro lesson initiative that we started a couple years ago. This is a really fun outreach program that we designed to make molecular pathology concepts more accessible to and engaging to patients and the public. So with that, I'm going to pass it over to Leigh-Ann for her presentation.
Great. Thank you so much, Kyster. So, as you mentioned, OMPRN engages with patients to improve the understanding and accessibility on the topic of molecular pathology. So, what does patient engagement look like at OMPRN? We have our patient partners involved in conferences that we host as both attendees and session chairs, and we have the patient voice also in our steering committee. However, a big bulk of what we do with regards to molecular pathology education is the development of these microlearning modules that Kyster also mentioned. These micro lessons came about to address the gap of patient understanding of molecular pathology, and we found that there is a lack of useful, accessible resources that are available online and that are kind of all in the same place. And that's exactly what OMPRN has done. We have created lessons that empower patients to have the knowledge to have meaningful conversations with their healthcare professionals and providers. All of our micro lessons are patient-led, and we have patient partners involved every step of the way. All of our micro lessons do follow this microlearning format. So what is this format essentially? This format is a condensed lesson that is a wide variety of formats that are available online and are under 10 minutes. We have found this method to be extremely learner-centric and very easy to digest. So next, I'll take you through how we create these micro lessons with this format in mind. So first, we would consult with our patient partners and we would kind of decide on a micro lesson topic. From there on, we would then go and create specific learning objectives as well as outcomes for that lesson. Thereafter, with our patient partners, we will create a script or the content of this lesson based on the learning objectives that we have outlined. We would then keep the microlesson format in mind when putting this together and get feedback from our patient partners. Once this content is finalized, we will then go and create a storyboard or a draft of what the lesson would look like. Once this is complete, we will go on and create the lesson and have constant rounds of review and feedback from our patient partners. Once this is complete, we will disseminate the lesson on both our website and social media pages. And as science is ever ongoing and changing, this is kind of a feedback process where we constantly try and review our lessons to keep our lessons both current and relevant. So just to show some of our micro lessons in question, we have over 15 currently available on our website that we are really proud of. And as you can see, we really try and be as creative as we can be with regards to the format. We have infographics, whiteboard animation videos, and even a storyboard. Here's just another slide of some of the other lessons we have available. I will add the link to these resources in the chat after the presentation if anybody wants to take a closer look or perhaps go through these lessons. And I think it's also important to note that the content of these micro lessons that we include is to empower patients with the knowledge, to have meaningful conversations with their healthcare team. We do not provide medical advice in any capacity. But our molecular pathology education is not just limited to our micro lessons. And I would like to highlight some additional resources that we have also put together in recent years. First is our enhanced glossary. We have over 100 glossary terms available on our website. These terms came about either mentioned in our micro lessons or touched upon. And we really wanted to make our glossary stand out above other glossaries that are available online. So we have added a few key ingredients. Namely, we have included the pronunciation of the term used in an example sentence, as well as an image that correlates to the term. Another resource that we have done was we created an infographic titled Support Professionals in Cancer Care, which highlights all the support professionals patients and caregivers can encounter through their entire cancer journey. It takes them through the roles and responsibilities of each professional, as well as has a list of questions they can ask each healthcare professional specifically. We found that patients sometimes get overwhelmed when having to meet with these professionals and their doctors, and felt this resource quite valuable. So we have dedicated a page on our website for each healthcare professional as well. Recently, we have also started to create interviews and have interviews with each one of these professionals about their role in cancer care and have this included on this specific landing page as well. Prior to this meeting, I asked Maureen to pass around the specific infographic in question, which was the support professionals in cancer care. And as you see on the right here, I have put all the professionals that we have included in this infographic and kind of want to throw it to the audience here. Are there any other professionals that you thought of when looking at this infographic that you kind of think that we have missed, or that you think that we can include in the next revision of this infographic? So you're welcome to put any responses in the chat. Yeah, medical laboratory technologist, that's a good one for sure. Patient navigator, yes, tend to agree. Oncology nurse, I believe, is included. Yeah.
I think it's a nurse practitioner that was specifically.
Oh, okay, sure. Thank you. Thank you for these. Great. Thank you. You can continue adding the responses to the chat, and we'll definitely take notes. It's part of the whole process at OMPRN, where we review our lessons constantly. So thank you for everyone's input. So So collaborations with different organizations on microlessons is something that we have done and would like to do more of in the future. So just to highlight some of the collaborations that we have done. So we've done an infographic with OHCRN, which is the Ontario Hereditary Cancer Research Network, on the topic of what is the differences between hereditary, familial, and sporadic cancer. This was an infographic and is currently available on our website. We have also recently explored connecting with patient cancer care support groups, and a notable connection that we have made is with Wellspring Canada. For those of you who are unaware or don't know what Wellspring is, it is a Canada-wide network of charities offering programs and services at no charge and without referral to anyone with any type of cancer at any stage of their journey. We conducted a 4-part webinar series in March on the Wellspring online webinar account as part of their Be Well Talks initiative on all things molecular pathology, and we also tied it in with some of the resources that I've mentioned that we created kind of to create a holistic presentation. So the 4-part series started off with how does cancer spread and where does it come from, followed by what is molecular pathology, understanding my clinical report, and we ended off this series with being involved in your cancer diagnosis and treatment. Week 4 was quite special as we had our patient partners present that installment. And for anyone that wants to take a look at this, it was all recorded, and we have a dedicated webpage on our website for this as well, if anyone wants to take a look. So finally, I just want to end off by promoting our social media accounts, as well as share our specific QR code to access all of our resources that were mentioned today. And I would like to open the floor for some discussion and particularly highlight that if there is anyone in the audience today that has an idea for a specific lesson in the realm of molecular pathology, and they want to collaborate and work with OMPRN, or know perhaps of a group that would like to create a lesson with us, please don't hesitate to reach out to us. And I'll include the links to all of these resources as well in the chat.